Hello there, and a warm welcome to our channel. We're glad to have you with us today. We are here to talk about a topic that's very close to our hearts, and that's health. More specifically, we're going to discuss the 10 most common signs of colon cancer. Early detection is crucial, and being aware of these symptoms could potentially save lives. If you encounter any of these symptoms, please consult your healthcare provider. Stay with us as we delve into the 10 signs that might indicate the presence of colon cancer. Starting with the first sign, a change in bowel habits. Now, what does this mean? It refers to any shift in the regularity, consistency, or ease of your bowel movements. Everyone has their own normal, and occasional deviations are to be expected. Maybe you ate something that didn't agree with you, or perhaps you've been under a lot of stress. But when these changes persist for an extended period, it's time to take note. Are you finding yourself running to the bathroom more often than usual? Or maybe you're straining more, or your stools have become notably thinner or looser. It's important to remember that these changes don't automatically mean you have colon cancer. They can be caused by various factors, including diet changes or gastrointestinal conditions. But if you're noticing a persistent and unexplained change in your bowel habits, don't ignore it. Remember, a persistent and unexplained change in bowel habits warrants a visit to your healthcare provider. Moving on to the second sign, blood in your stool. Sometimes it's something that can be easily overlooked, especially if it's not a regular occurrence. But spotting blood in your stool is not something to be ignored. The blood can appear in two forms. It could be bright red, which indicates that the bleeding is occurring near the end of your digestive tract. On the other hand, if the blood is darker, it suggests that the bleeding is happening higher up in your colon or digestive tract. Now, it's important to remember that blood in your stool doesn't necessarily mean you have colon cancer. Hemorrhoids or anal fissures could also cause blood in your stool. However, it's a common sign of colon cancer, and it's essential to get it checked out. Don't ignore blood in your stool. It's crucial to get it checked out. The third sign to watch out for is abdominal discomfort. This discomfort can take on many forms, such as a persistent ache, a sensation of bloating, or even sharp stabbing pains. These symptoms might be easy to dismiss as just a bout of indigestion or a result of overeating, but when they persist, it's time to take note. Now, it's important to understand that abdominal discomfort on its own doesn't necessarily indicate colon cancer. It could be a symptom of many different conditions, some of them quite benign. However, if this discomfort is accompanied by other signs we're discussing in this series, it becomes a cause for concern. Remember, your body is constantly communicating with you, and persistent discomfort is its way of telling you that something might be amiss. So, if you've been experiencing ongoing abdominal discomfort, it's crucial to discuss these symptoms with your healthcare provider. Persistent abdominal discomfort should never be ignored. It's essential to consult with your healthcare provider. The fourth and fifth signs are unexplained weight loss and fatigue. Unexplained weight loss is when you shed pounds without a clear reason, such as changes in diet or exercise habits. This can be a subtle symptom of colon cancer, especially if it's combined with other signs on our list. On the other hand, fatigue, which is more than just feeling tired, is a persistent state of weariness that develops over time and reduces your energy, motivation, and concentration. When you're constantly feeling drained, it could be your body's way of telling you something's not right. Now, when these two signs, unexplained weight loss and fatigue, come together, they can paint a worrying picture. They might be your body's way of signaling that it's battling something as serious as colon cancer. This is why it's so important to listen to your body and take these signs seriously. If you're experiencing unexplained weight loss or constant fatigue, it's time to talk to your doctor. The sixth and seventh signs are a feeling of incomplete emptying and iron deficiency anemia. Let's unravel these two. First, incomplete emptying. This is when you have the sensation that your bowels are not entirely empty, even after going to the toilet. It can be a bothersome feeling, and might lead you to make more frequent trips to the restroom. This could be a sign of colon cancer, as a tumor might be obstructing the passage and causing this feeling. Now, on to iron deficiency anemia. Anemia refers to a decrease in the number of red blood cells, and in this case, it's due to a lack of iron. This can lead to unusual tiredness, pale skin, and other symptoms. Colon cancer can lead to long-term slow bleeding in the colon, which can result in iron deficiency anemia. Both these symptoms require medical attention. Don't hesitate to reach out to your healthcare provider. The eighth and ninth signs are nausea or vomiting and abdominal cramping. Persistent nausea or vomiting might not be just a sign of a stomach bug. When these symptoms linger, they could indicate colon cancer. Similarly, abdominal cramping that doesn't go away could be a sign as well. This cramping is often due to the tumor causing a blockage in the colon, leading to discomfort and pain. It's important to understand that colon cancer symptoms can be vague and easily mistaken for other conditions. However, what makes them stand out is their persistence. So if you've been feeling nauseous, vomiting more than usual, or have been experiencing abdominal cramping that just doesn't seem to go away, it could be more than just a simple upset stomach or a case of food poisoning. These symptoms, especially when combined with other signs we've discussed, should not be ignored. If you're experiencing these signs, it's crucial to seek medical attention. The last sign, but certainly not the least, is personal or family history. It's a crucial factor that cannot be overlooked. If colon cancer has been a part of your personal health history or has shown up in your family line, your risk of encountering it again is significantly heightened. This is due to the fact that certain gene mutations, which can be inherited, increase the likelihood of developing the disease. We're not saying this to scare you, but to emphasize the importance of being proactive about your health. If you've personally had colon cancer before, or if it's shown up in your family, it's essential to keep regular screenings on your health calendar. These screenings can detect early signs of cancer when it's most treatable. Your history matters. Regular screenings are vital if you have a personal or family history of colon cancer. Remember, early detection can make all the difference. Don't wait for symptoms to show up. Be proactive about your health. We've covered a lot of ground today discussing the 10 signs of colon cancer. It's been quite a journey, and we hope you've found this information both enlightening and beneficial. Let's take a quick recap. We've explored changes in bowel habits, which can be indicative of an underlying issue. We've also delved into the concern of finding blood in your stool and how this should never be taken lightly. Then, we talked about abdominal discomfort, a symptom that can often be dismissed as less serious, but may have significant implications in relation to colon cancer. We also discussed the signs of unexplained weight loss and fatigue, two symptoms that can be easily overlooked or attributed to other, less severe conditions. We've mentioned the sensation of incomplete emptying after a bowel movement and iron deficiency anemia, both of which can be subtle but important signs. Additionally, we've shed light on nausea or vomiting and abdominal cramping, signs that can be mistaken for common stomach issues but might be indicative of something more serious. Lastly, we've highlighted the importance of considering personal and family history, as they can significantly impact the risk of developing colon cancer. Remember, while these signs can be associated with other conditions, it's essential to consult a healthcare provider if you notice any of them persistently. Early detection is crucial in managing and treating colon cancer, and every bit of awareness helps. We encourage you to share this video with your friends, family, and loved ones. Spreading this knowledge can potentially save lives, and together, we can make a difference in raising awareness about colon cancer. Thank you for visiting our channel. Remember to subscribe because it helps us create more videos like this for you. Like, share, and hit the notification bell for future videos. Stay healthy and take care.